This Medical Minute sponsored by Avera.
After breast cancer patients had their tumor removed, radiation therapy is often required to reduce the risk of the tumor returning. Now, this can involve coming in daily for weeks at a time. In tonight's Avera Medical Minute, Tess Hedrick explains how electron-based intraoperative radiation is different than standard radiation therapy and how it benefits patients.
Well, we have patients that live all over South Dakota and the other states. They're driving every day to come in for radiation.
Breast surgeon Dr. Julie Ryland says electron-based intraoperative radiation therapy can take away that daily back and forth for breast cancer patients.
But when we do this in the operating room, they come in for their surgery, they get their radiation, it's a 2-minute treatment. They're asleep the whole time, and they're done with their surgery and their radiation in one day.
In IORT, the patient receives a high dose of radiation therapy during their lumpectomy.
Well, we know that when a woman has breast cancer and when we take out that lump, her chances of having cancer cells in the area are highest within 2 centimeters of where that tumor originally was. So instead of radiating the whole breast and putting a woman through 6 weeks of radiation every day for 5 days a week, we're now giving radiation just to the area where the cancer was, and we're destroying any cells that may be in that area where the highest risk for residual cancer is.
This does as little damage as possible to normal tissue around where the tumor used to be.
But then these women also have no side effects from the breast, from the external beam radiation, which can cause some darkening of the skin, can cause almost like a sunburn. That's all gone because we do the radiation inside the breast and we don't let the skin get touched by the radiation.
I am going to be a 5-year survivor this month.
Sherry Baisley was one of the first patients at Avera to receive intraoperative radiation therapy.
I think for me, just the technology, just new technology. I'm also involved with Susan G. Komen, so knowing that research, advances what happens. My mom's a survivor, so I know what she went through 20 years ago, and it was brutal, and how different the treatments have been.
We started out very conservatively, and we just gave a boost and then followed that with 3 weeks of radiation, which was still cutting down 3 weeks of radiation for those women. And so she had the boost plus 3 weeks, so she still has some external signs of having had radiation, but she still got in on that, and she was part of what made us. Now we've morphed into doing this where we're actually giving it in 1 dose.
Avera was in fact one of the pioneers in joining us.
Dr. Felix Sedelmeier is the head and professor of the Department of Radiation Oncology at Paracelsus Medical University Clinics in Salzburg, Austria. He's helped lead the way in intraoperative radiation therapy.
There are few things in radiation oncology of the last 15 years where I'm so convinced that it was a surplus for the patients. I mean, we are talking about in-breast control rates of 98% plus after 10 years.
With your Avera Medical Minute, I'm Tess Hedrick, KSFY News.
Now, whether a patient has IORT or traditional radiation to the whole breast will depend on several factors, including your age, the size of the tumor, the type of cancer cells that make up the tumor, and the size of the breast. For more information, call 1-877-AVERA or go to ksfy.com and click on Health.